Meantime, let's check the latest COVID data around New Jersey. Nearly 1,400 new cases reported today. Rate of transmissions up a little bit since last week. We're at 1.07. Hospitalizations continue to remain in the 1,100 to 1,200 range. As for the vaccine rollout, 5.77 million New Jerseyans now fully vaccinated. We added another 6,300 people to the total since yesterday. Pfizer with big news today. They're announcing their COVID vaccine has tested well for kids between the ages of 5 and 11. News 12 New Jersey's Chris Keating reports that the determination comes after the pharmaceutical giant completed recent clinical trials of children.
With this announcement, Pfizer is saying that their COVID-19 vaccine is safe for your child. Their clinical trials are showing that antibodies are present just as they are in 12 to 17-year-olds who got the shot. October 31st has been the goal for getting doses of the COVID-19 vaccine to children under 12. That goal is now getting closer to reality. Very soon, Pfizer will present its latest clinical trial data to the FDA to gain emergency use authorization. Pfizer's trial involved over 2,000 children who were given a 2-dose regimen 21 days apart. The difference was that the children were given doses with 10 micrograms of vaccine as opposed to the 30 micrograms in a teen or adult dose. The CEO saying, since July, pediatric cases of COVID-19 have risen by about 240% in the U.S., underscoring the public health need for vaccination. These trial results provide a strong foundation for seeking authorization of our vaccine for children 5 to 11 years old.
Certainly the immune response looks brisk and the kind of immune response you would expect to be associated with protection against disease. We certainly need a vaccine for children.
Dr. Paul Offit says questions the FDA will be asking Pfizer include the topic of side effects and the consistency of the immune response in children tested. Here in New Jersey, 59% of kids between 12 and 17 are now vaccinated. The vaccine is thought to be especially important toward keeping children in school. Governor Murphy commented on the possibility of getting more school-aged children vaccinated.
How much safer will we be if 5 to 11-year-olds? I would think it's a big step.
Across the U.S., more and more children are getting infected with coronavirus, especially due to the Delta variant. Children account for nearly 29% of all cases. And considering that students in our elementary schools only have masks and social distancing as protection against the virus, health and state officials are looking forward to the release of this vaccine. I'm Chris Keating, News 12 New Jersey.